Hi, I'm Dr. Robert Jones. We have three physicians here, Dr. Huber, Dr. Alexander, and myself, all of whom are happy to do eyebrows. It's one of the procedures we enjoy doing because patients, generally speaking, are very happy with the results. And today we're doing Anna's eyebrows. She's come in from Toronto just to have the procedure done today, usually about a 2 or 3 hour procedure. Now, the way we do this is we take hair from the back of the head and just plant it in the brow, and depending on how much the hair the patient needs, we take more or less, and within 3 or 4 hours we can extract and plant the grafts that we need to do to give the patient a bushier eyebrow. So Anna, how did you end up here? Maybe tell us.
Sure, I would love to. When I was a preteen, I had a girlfriend overpluck my eyebrows, and unfortunately they never grew back, and eyebrows that were thin were in style then. They are no longer in style today, so here we are.
That's a common story that we hear, is that once you pluck the eyebrows, they won't grow back. So she's a good candidate. She's got nice thick hair. She's healthy otherwise. And with thin eyebrows, we should be able to easily thicken them up. So what we'll do is just bring them a little bit farther medially on both sides, just because it looks like they've been plucked on the inside, and just thicken them up the whole way back. So we'll probably end up in about the same spot, but just create a bushier eyebrow the whole way from the middle right out to the outside. So the next step in this procedure is actually to design where we're going to put the eyebrows. And this is actually easier. In a lot of cases, what we have is no brow at all. So we have to design the brow from scratch, where with Anna, we have a brow to work with. So what I'd suggest is that we just come a little bit medial here and put a few, just a little bit sort of more medial to the brow on each side. And then just basically widen the brow the whole way. So she wants a nice sort of Brooke Shields wide eyebrow. So what we're going to do is just expand, and then the end we'll leave in about the same place. So and then we'll put hairs not only above and below, but we'll also put them in the existing brows. Now, one downside of an eyebrow transplant, since we're taking hair from the back of the head, is it continues to grow. So one downside is that there's some maintenance involved. Is as they grow, she's obviously going to have to trim these, probably sort of once every week or so. She'll have to do some trimming. So the same on this side, we'll just make it a little bit wider. So now what we've done is we've drawn on your brow, and what I've done is extended your brow about 1/4 of an inch medially on both sides, and about 1/8 of an inch above and below your existing brow. So not only will we put the grafts above and below, but also in your existing brow. So it should make it much more, the brow much more appealing, and I'm sure you'll be happy with that design.
Oh, I'm thrilled. I can't wait.
The way we do the extractions for this procedure is by using a technique that we just pluck the grafts out one at a time. Rather than cutting and the patient needing stitches, we use a tiny punch. It's called Follicular Unit Extraction. We can do up to 3,000 plus grafts and do an entire head, but for somebody like Anna, we don't need a small number of grafts in the backs. And the other difference is that we do, for brows, we do all single hair grafts rather than larger grafts that we quite often do 2 or 3 or even 4 hair grafts sort of up on the top of the head. So we're going to do all singles because brow hairs tend to be just single hair grafts. Okay, the next step is just to numb you up. So you're going to feel a little pinprick here. You're doing great. So this is a little uncomfortable, but it's about the only discomfort you're going to feel in the whole procedure, including after the procedure, is just the numbing. Afterwards, there's almost no pain. This is the 0.9 millimeter punch that we use to extract the graft. This will take grafts out usually between 1 and 4 hairs, depending on how the grafts present with the patient. So we'll remove enough grafts to do the eyebrow, and Shari One will dissect the grafts into single hairs, so we only have single hairs in the brow. As you can see here, this is the graft that we've just removed, and if you look closely, you can see that there's 3 hairs in that one graft, even though we've just used a 0.9 millimeter punch. So we've now extracted the grafts from the back of Anna's head. So the next step in the procedure is to insert them in the brow. And the steps in doing this include, first we numb the area with just local anesthetic. After numbing the area, we put tumescence in, which is just saline with some adrenaline, which is going to blow the area up about 1 centimeter or 2 above where they are now. And the reason we do this is for 2 reasons. One is the tumescence with the adrenaline cuts down on the bleeding. The other is it expands the area to make it easier for us to get the grafts closer together. And so when it goes back down again, the grafts will be closer together. So the next step is to make the sites. And the way we do that is we have a tiny blade, which is about, it's cut from a surgical blade. It's about 0.8 millimeters across. And this is the exact length of the follicle that we're going to be implanting. So what I'll do is I'll make this pocket, which is about 0.8 by probably 3 millimeters. And that pocket will be the exact size of the graft that we're going to be inserting. So I'm going to make, in each brow, I'm going to make about 250 of these sites that we'll be putting the grafts in over the course of the next few hours. Now there's a few little tricks with an eyebrow transplant that make them look more aesthetically pleasing. One is, the main thing is just lay the grafts down as tight as you can to the skin. You want them to sort of mat on each other. Also, if you look carefully at the shape of a brow, in the medial aspect of the brow, you can see the hairs go from sort of the eye up, angling a little bit out. And as they move out, the hairs then angle towards the lateral part of the brow. The other thing is that they will angle from the top down and from the bottom up and sort of create sort of more density in the center of the brow. So it's important just to create that sort of natural look in order to create a natural looking brow.
So hi Anna, it's been 2 weeks since your procedure.
Yes.
How's it going?
Good. I mean, as you can see, my swelling has completely gone down. That happened pretty quickly, I would say 3 days.
Yeah.
Redness is almost all gone. Pain is all gone.
Yeah.
My
So
donor
did you have any pain? Did you have any pain at the sides or the back or anything like that?
No, the donor area honestly was the most shocking because it felt like nothing had happened. And it looks like nothing happened. It was incredible.
Well, that's actually the nicest thing about the FUE versus the strip, because when you take a strip out and put sutures in, it can be quite painful. Where with the FUE, we're just plucking out hairs. There's virtually no pain afterwards. Now, what we usually expect after the procedure is the hairs will all shed and then start to grow at about 10 or 12 weeks. And it takes good 6 months to a year before you get full growth. So you have to be a little bit patient. But no, exciting. It looks like, I mean, with a bit of makeup on, people would probably not even know you've had anything done at this stage. Is that, yeah?
Yeah, that's pretty accurate. I mean, I've been vocal about it, but from what people have seen, they're really excited to follow along, and I've only heard good things so far.
Right. So you were referred by a friend. Have you talked to her about how hers was after the procedure?
I hadn't. I should.
All right. We did her quite a few years ago, didn't we?
Yeah. So for the referral that I did get, I saw her come into an office one day and I saw her eyebrows and I was blown away. I said, "Where did you get those?" And she had mentioned your name. And so since then, I've been counting down the days until I got to come see you, Dr. Jones.
That's nice.
Yeah.
Well, things have progressed perfectly normally for this stage. And what we'll do is maybe follow up in 3 months again. So give it a few months, and when we see in 3 months, we'll start to see some growth.
It's exciting.
Okay, good to talk to you.
Good to talk to you.